Welcome, listeners. I am feeling so blessed today. I have someone who's become a good friend, Marrie Simpson. She's a physician's assistant, but the journey I took to find Marrie was, I was kind of lost. And we're going to be talking about menopause today and details about it and what you can do. And the reason we're talking about that is because, and Marrie, I don't know if you know this, but divorce is growing the fastest in the age of 50
Mhm.
or so. So it is pertinent. And I do have clients that are going through it and they're asking me kind of general questions. So I love sharing information that's going to help them to a better life because it's hard. It's an opportunity, just like divorces,
Yeah.
but it can be difficult. But so
Mhm.
I want to welcome you here, but I also want to say that you have been such a blessing in my life. And I found you because I was just searching. This was before I was going through menopause, and I have autoimmune issues, and I kind of was a mess. I came in, I was anxious to go to the doctor, I was afraid to get my blood pressure, and it
Yeah.
became this functional assessment journey. And I learned, which I carry with me, that we're all unique and we all have different stories. And I also wanted a Christian. That was really important to me. And I was so thankful that a good friend of mine recommended you, and you fit everything I wanted and were so much more.
You're too
Honestly,
kind. Mhm.
no, but I really mean it because I think that had I not taken this route, I know I have some autoimmune issue, but
Mhm.
because we've figured out how to lower my inflammation, it's not something that I need to have tested, anymore. And so
Right.
I feel so blessed. And then as I was working with you, menopause came along. And so I got to, and now I'm kind of through that, which we can talk about later. But
Sure.
it's a hard time, but it is a time where you can dig in and learn about yourself. So anyway, I want people to get to know you, Marrie. That was kind of long, but
Yeah.
thank you so much for being here and
Oh,
welcome.
yeah. It's my pleasure. My
And
honor.
can you tell your story about what made you delve into functional assessment medicine?
Mhm. Yeah. Well, I had practiced for, gosh, maybe 15, 18 years. And I, was prescribing lots of prescriptions. It got to the point where I was not having a lot of time to spend with patients and really felt that there was more to it than prescribing prescriptions and quick little visits and that type of thing. So I started actually in hormones and I went through some courses with IFM and then I became certified with the Metabolic Institute, which is A4M, and started in the hormonal piece of functional medicine. So after 4 years or so, I became board certified in functional medicine, and really not again with just hormones, but looking at immune function and digestive health and brain health. And since then, I have taken a number of courses through a number of formats, starting with Dr. Dale Bredesen. He wrote the book, The End of Alzheimer's, which has been pretty influential in my current practice. Also, deeper dives with Lyme and mold and environmental toxins and epigenetics and in lots of different areas, and it's so fun to learn. I love learning, so it's fun to learn how to apply a lot of this. So with that, then I was able to continue practicing at Western Wisconsin Health as a functional medicine practitioner, and it was great to have more time. I was able to spend between 60 and 90 minutes with each of my patients and really get to the root cause of what was causing symptoms and or disease so that we could address those and really enjoyed my time in that. So yes.
And I forgot to mention that you're the founder of Elevate Health and Wellness.
Yeah.
And,
Yeah.
we're going to talk a little bit more about that, but you're kind of helping people in a different way now. You're not at the clinic anymore. And I kind of miss you because
Yeah.
it was nice to have you,
Yeah.
there as my doctor. But I want to learn more about that too. But
Sure.
so why don't you talk a little bit about that now? I was going to have you talk about it at the end, but tell me what
Sure.
you're doing.
Yeah. So about a year and a half, 2 years ago, I was I've always kind of wanted to start my own practice or business. And so I was looking into some different mentorships that would allow me to do that. And one of the mentorships offered a program that I'm offering in my business now, that I actually went through. And so it was recommended that I go through it if I were going to maybe incorporate that into my business. And um, so it's something similar. Mine is called the Elevate Health and Metabolic Reset. And when I went through that program, I was able to lose 60 pounds and have been able to maintain that weight loss amongst, improving inflammation and my metabolic health overall, improving hormones and that type of thing. So it's so much more than just weight loss. It's really getting at, again, root causes for it. May be digestive issues, it may be memory, focus, it may be balancing hormones. So it's been great for weight loss amongst a number of other things.
And I've always found that weight loss portion, it's the mind. It changes. It changed my business. I mean, it changed who I am just to get healthy. And so I'm sure it's packaged as weight loss, which is wonderful, but it's so much.
Right.
It's getting
It is. Yeah. It's just the foundational elements. There's various pillars that we work toward of getting to a root cause of illness, but then also really improving your metabolic rate and reducing inflammation all at the same time. So I incorporated the functional medicine twist in all of that. I love talking about longevity hacks for women and those types of things as well. So it's great.
We all need that. And so now if we can kind of talk about menopause.
Yeah, for sure.
I've had a couple listeners and a client that I feel like it's just a very general, they're feeling lost. And I think they're probably a little bit younger than me. They're just getting into it. They're like, I feel like I have, PMS all the time. And so imagine you're going through that and you're going through a divorce and it's so much. So I just want to help them, maybe if they can understand menopause a little bit first, and then some things that they can do to get them through it a little bit.
Yeah. So, pre-menopause can take place 10 years before you actually are done having a menstrual cycle for over a year. So that's kind of what diagnosis is menopause, is when you haven't had a period for a year. But that time beforehand can be really difficult. And oftentimes hormones are fluctuating. It's just not that they stop. Your ovaries stop making hormones, but they're going up and down. And stress is a huge contributor to imbalance of our sex hormones. And obviously, when you're going through a divorce or having some marital issues, then most people are pretty stressed. And so that is going to contribute to some of the symptoms that you could get. Oftentimes hormones become imbalanced and we tend to see more estrogen dominance, meaning higher amounts of estrogen and smaller amounts of progesterone. And we really want to balance those hormones. And again, it starts with balancing cortisol. And so there's a number of things that you can do. Again, we focus on belly breathing or, time in nature. We want to make sure that you're getting adequate sleep. That's when your brain detoxes. And so protecting that time, circadian rhythm can play a role with hormonal health as well. And really trying to optimize, not being exposed to blue light and getting to bed at a particular time, having good sleep hygiene. All of that can be helpful, along with getting some forms of movement or exercise. Some people can't exercise because of underlying joint issues or whatever it might be. But even just getting good movement in each day is going to be great. Nutrition is foundational for balancing hormones as well. And many people that come into my program may have night sweats, hot flashes, those types of things. And within 4 or 5 weeks, those things are balanced. Again, just really working on lifestyle and nutrition. That is
So helpful. And I think about, well, and what's so tricky, Marie, is that I know in my own life, you can, and we'll talk about tests you can take to find out what your hormone levels are, but they're
Mhm.
always changing.
Yep.
So it's so
Yeah.
hard. So I do think that lifestyle thing, and one thing, I love my wine, but what I've learned is that drink a glass of wine, I'm not going to sleep.
Yep.
I'm going to get hot flashes. And when
Hmm.
I take that out of the equation, it's a game
Hmm.
changer. So now I still might have wine sometimes, but I know, well, I better not be doing a podcast the next day because I'm probably not
Right.
going to sleep really well. So
Yeah.
you can still, I don't cut it out totally, but those
Yep.
lifestyle things are, I think, the main thing that you can do for yourself.
Mhm.
It doesn't mean that they're probably all going to get balanced. I do have a question when you talk about nutrition, like we all know sugar is not a great thing. I've heard in the past, and I don't know a lot about it, that there are some foods that can balance your hormones. I can't
Mhm.
remember which one balances what, but I thought like a sweet
Mhm.
potato could help you
Yeah.
produce a certain, do you know, is that true? False?
Well, phytoestrogens are probably at the top of the list, and um, soy being one that can be beneficial. The problem with soy is that it's genetically modified and heavily sprayed, and so it at the same time can be a bit detrimental. Getting in a lot of cruciferous vegetables is really important. There are some, there's DIM and I3C. And I won't get into the structures of all of that, but cruciferous vegetables have that, and it's able, then it allows you to be able to detox the estrogen better. And so your estrogen needs to have a detoxification pathway, and so those phytochemicals and nutrients are going to be really helpful for that. And then again, getting methylated B vitamins in is going to be really helpful for that as well.
How do you get
Um,
those vitamins? Methylated.
so, so I usually for women that are either estrogen dominant, and there are some symptoms of that. People that have PCOS, people that have maybe fibroids, heavy periods, PMS, breast tenderness, all of those can be, and it's not limited to just those,
Right.
can be a symptom of having estrogen dominance. Again, having too much estrogen, having too little progesterone. And so those factors, as far as reducing or eliminating alcohol, can be helpful. But then getting in those cruciferous vegetables, and I usually recommend using a methylated B complex.
Okay.
Um, so if you look at the bottle of your B complex and it says methylfolate or methylcobalamin, that's going to be a bit of a clue, but you can go to a number of nutrition stores and ask, and they'd be able to point you in the right direction.
Okay.
So getting that in one a day, they're very inexpensive, maybe, usually sold in 2 month worth. And so maybe $10 a month would be what you'd pay for a nice B complex, maybe 15. So
Okay.
at any rate, I think that's really helpful. And you're right, when you bring in that alcohol and or sugar, it often is going to increase menopausal symptoms as well as adding in that stress. And
Mhm.
so what you can, do to reduce or eliminate the alcohol, and if you have an occasional glass, probably not the biggest deal. For women that have had a breast cancer, I don't recommend alcohol at all. But at any rate, minimizing that and optimizing sleep and nutrition, movement, all of those things.
Right. Okay. So now I have to ask you this, and I don't know if there's
Mhm.
a great answer because I really want to make this so that if there's someone out there stressing out right now about this, that
Yeah.
there's going to be action that they can
Mhm.
take. Um, my issue is always sleep, sleep, sleep.
Mhm.
And so I've taken melatonin, a time released. Is that something that you recommend?
Yeah, I think melatonin is great. And I don't, and it's really good for our bodies. It's a
Mhm.
great antioxidant. It helps with our immune function. It's good for our brain. If people have trouble falling asleep, I generally recommend obviously doing some belly breathing or intermittent nostril breathing, avoiding screens, you know, um, doing your taxes before bed or whatever it was that I did recently. But um falling asleep, immediate release melatonin, maybe a 3 to 5 milligram, somewhere in there. Some people are really sensitive, so you have to be a little bit careful. But most people will tolerate 3 to 5 milligrams well. And then if you're having trouble staying asleep and waking up frequently, then using an extended release can be helpful for that maintaining sleep. And obviously, we want to think about why aren't you sleeping well? So getting to the root cause of that. But in the meantime, I think melatonin can be very helpful. And I don't think that, and in fact, in some cancers, they're using hundreds of milligrams of melatonin, particularly breast cancer is one that's being studied now. So at any rate, I think it can be very helpful.
Is there any reason that I shouldn't be taking it? If I'm taking it all the time, would there be a reason to stop?
I don't believe so. I don't think so. So
Okay.
I think it's safe. Early on there was talks about if we're using it, will our body produce less? But that hasn't been shown to be true. And actually, when people are stressed, they often don't make enough melatonin. And so adding that melatonin in can be helpful. Back with COVID, it was recommended that people, even if they didn't have trouble with sleep, add in melatonin for boosting
Right.
immune function. So I think it's fine. If you don't tolerate it, I won't use it. So some
Right.
people say, gosh, if I take melatonin, you know, I feel wired.
Oh,
It's
that's
probably
weird.
less than 1 or 2%.
Yeah.
It's not a common thing. So yeah.
Okay. So this is so helpful because this is something that someone who's having issues like these women that I talk to, something that they can do right now. And I know in particular, this one works out, has good nutrition, but
Mhm.
to make sure that she has a lot of stress and it's hard. Her
Mhm.
parents are needing her. One's going through Alzheimer's.
Yep.
So, but doing your best to take that time, do that self-care so that you can get through this. Eat your broccoli so that your estrogen can stay. So
Mhm.
all these things in themselves will help you.
Yep.
Um, and and if people want to delve deeper, I know I've taken the Dutch hormone test and I
Mhm.
actually did take some progesterone at a
Mhm.
time. And I, used a little estrogen
Mhm.
now just for
Yep.
dryness or, whatever.
Yep.
So what kind of tests do you recommend to get a handle on what's really going on with your hormones?
Yep.
And then what do you think? Like, and even there's like progesterone cream. I can't remember what
Mhm.
it's made out of, like a yam. I
Yep.
started
Yep.
doing that a little because at this point I basically have no hormones. I mean,
Sure. Yeah.
you know.
Yeah.
So okay, I just threw a lot at you.
Yeah. No, I'll break it down a little bit. So, with regards to testing, if you are postmenopausal, likely if you have hormone tests, they're going to be low. The best way to evaluate hormones is not through a traditional practitioner's, um, clinic and getting blood work done. It's more accurate to assess hormones either through urine or through saliva.
Yep.
Now, it's one thing to look at them to see, okay, are they optimal, high or low? And postmenopausally, the majority of the time, they're going to be lower than what they should be. Now, if you're going to consider using exogenous hormones, and that would be where you're taking them in, whether it's by mouth. And I just want to point out that I never ever recommend taking estrogen by mouth just because it really increases risk for cardiovascular, particularly for stroke. And so if you use estrogen orally, again, you have increased risk of stroke. Even with birth control pills, we see that birth control pills are the number one cause of stroke in women in their 30s and 40s. And we don't see them used that much, after 50. The average age of menopause is 51, but we can see it start between 30 and go close to 60 or a little beyond. So at any rate, that can vary. If you are going to use any exogenous hormones, we think of endogenous when your body makes them yourself,
Yep.
but exogenous if you take them on your own, then I always recommend a topical form of estrogen, and that can be done either through a patch, which there are patches that are available through prescription, and or a with a cream. And so most bioidentical hormones that you would get from a compounding pharmacy are going to be in a cream. And one of the nice things about that is that you can use the different, you can use estriol, which is protective, and estradiol, which is more effective, and do a combination of those. If you use any estrogen, you always, always, always want to use progesterone. And whether you have a uterus or not, we want hormones balanced. And so very important to not have too much estrogen and too little progesterone. Progesterone can be taken orally as well as topically. Most often it's used orally. And I don't recommend the use of synthetic progesterone. We really want to focus on using identical progesterone. And there is a form of more of a bioidentical prescription in the form of prometrium. The downside of that is it only comes in 2 different strengths, whereas if you're taking progesterone that's been compounded, then you can get it to whatever your unique needs are. So you always want to use progesterone. If you use estrogen, you never want to take estrogen orally, only topically, whether you're in your 20s or 30s or those years beyond. So
okay, and I
answered all your questions.
Yeah, I think I'll ask more if you. I'll just keep digging.
Yep.
I will say the progesterone when I took that, it was like a calm.
Yeah.
I slept for the first time in years. I am just not a sleeper girl. But then, since I've changed my eating and I don't have sugar and kind of eat real food and don't have so much wine, I don't have as many issues. So I'm not really taking hormones, but I asked you I found something that says it's bioidentical at our little like family fresh, or it's like a little co-op.
Sure.
And it says it's bioidentical. I don't know if it's made with yams. I don't know what it is.
Yeah.
What do you think? I started using just a little bit of that cream. And I felt like, which it could all be in my head, but I felt like maybe I was sleeping better, but I don't know. And again, I'm out of the fluctuating now. I'm in my past menopause. I don't even know what you call it.
Well, if you haven't had a period for a year, then you're likely postmenopausal.
That's what I am.
Yep. So yeah, and so there are various creams out there. It's hard to know without looking at the ingredients. And a couple of the things that, it's really important to have a good, healthy carrier oil if you're going to use hormones. That's almost as important, not quite, but at any rate, because it's then going to help it get into your skin and not having toxins and those types of things. So you want to kind of, and you can go to ewg.org under skin. Yeah. .org. Okay. And I would recommend that for all of your body care products and things like that. And it's going to give it a score. And so it's you could also Google Skin Deep.
Oh, I think I have that. Okay.
Yeah. So you could look at that and kind of get a little bit of an idea of the safety of that particular product that you're kind of thinking about. But some of those topicals can be helpful. It's just not, you can't vouch for them all just because.
Right.
Yeah. There's a lot of differences in these types of things. And you're also able to find, and I do think these can be helpful for some individuals, is to use some vaginal like suppositories. So Bezwecken makes a couple different ones. And if any women have a history of breast cancer, we always want to caution them to talk to, regardless, the things that I'm telling you is just informative only. It's not, so always talk to, your healthcare practitioner about these types of things before going out and doing them. But with regards to the vaginal health, we have estrogen receptors all over our body, in our brain, in our kidneys, in our lungs, in our heart. And there are some nice studies that show that estrogen replacement therapy, bioidentical, hormone replacement, can be helpful to prevent cardiovascular disease, heart attack, dementia, those types of things. But they do carry with it some risk.
Right.
And so we know that 70% of breast cancers have estrogen receptors. That doesn't, so there's a lot of controversy out there about using estrogen in cancers. It's something that, I would be leery of, not to say that there maybe could be benefits. At any rate, with regards to, I kind of lost my train of thought there.
That's okay because I have a question.
Yeah, go ahead.
And I don't mean to divert you, but
Good.
so the estrogen, is it always only by prescription, or is there estrogen that you can get like for dryness or
So yeah, so that's you're
that's what
bringing me
we're
back
talking
on track. That's
about? Okay,
exactly where I was going. So
okay.
there are some vaginal suppositories that can be helpful that have a little bit of estriol. So estriol is a super, super, super weak estrogen, and actually has some protective benefits. And so estriol can be used vaginally, and it is over the counter in some formulations. And so sometimes they'll put a little bit of DHEA in with it. And then there are healthy carrier oils that help with absorption. So there are some that are on the market that are not prescription.
Where do you find those, Marrie?
Well, I have them on my Wellevate store,
Oh,
but you can
good. Okay.
also go to Bezwecken is one of the formulations. There's probably many others. That's the one that I know of. So at any rate, I do have a Wellevate store that carries literally thousands of brands and products.
That's where I'm going to go. Now, I'm a little bit confused about the carrier oils because
Mm-hmm.
I
Mm-hmm.
told you that I got that progesterone cream that
Mm-hmm.
needs an oil with it.
Well, oftentimes, yeah, there's going to be something that the ingredients are suspended in to help it get absorbed into your skin. And so there's Versabase, or there's a number of
So
different
you
ones
like
that are
put the
used.
oil on and then put the cream on?
No, it's mixed in with the product.
That's what I was wondering.
Yep,
Okay.
yep, yep,
Thank
yep. Good
you.
question. Yep. So
I'm
yeah,
taking notes here so
yeah, good
I can
for
write
sure.
about this too. So,
Yeah,
so helpful. Okay. So, and we are over time, but I'm going to ask one more question
yeah, sure.
because I have to, because it's being selfish, but it's for
Yeah.
me. So
Okay.
if you are me and you're feeling pretty good, you're going through life, but I basically don't have hormones. I mean, I really don't. Am I heading in the right direction if I find some good creams to just add a little bit like that estrogen? I'd love that protective because of my heart issues. And
Mhm.
um, I don't know. Is that something that you recommend, or is it kind of just okay to, if you're feeling good, you don't need them?
There is a lot of controversy over that.
I
And
know.
I think that the number one thing to do is to do foundational nutrition and lifestyle pieces.
Yeah.
And it's um so making sure that you're eating really healthy, getting whole foods in, focusing on vegetables, healthy proteins, and again, movement, sleep, managing stress, all of that, very, very important. Because we can take 40 different supplements and they're all really good. But if you're
Right.
not eating healthy, if you're not getting movement, if you're not getting good sleep, if you're stressed all the time, it's kind of like, I'm not going to use the analogy of eating frosting without cake, but you know what I mean? I mean,
Yeah.
that's a terrible analogy. But basically you want to get those foundations down and then do some building blocks on top of that. Because
Okay.
it would be harmful for you to use exogenous hormones if your detox pathways aren't good and you're consuming more alcohol
Right.
and your sugar and your nutrition isn't sound, because then we can often do more harm than good. So getting those foundational pieces good, and then assessing your uniqueness with regards to hormones. And if you're going to use hormones, I recommend seeing a functional medicine practitioner that is able to do it the right way. Because I think hormones prescribed with taken orally, for instance, and not using progesterone and not assessing,
Right.
For taking hormones, we really want to know what your metabolites are, and are they going down a pathway that could potentially increase risk of a cancer? And if so, then we don't want to use hormones.
Okay.
So you want to see someone that is very has experience and does it the right way, that tests levels, that tests metabolites at least once a year. So, that really gets a good family history. Generally would use a bioidentical
Yep.
form of estrogen and or progesterone. And then also, there's consideration of testing your genetics, your SNPs, to see about detoxification pathways and if there may be an increased risk. So all of that would be really important if you were going to seek that out.
Okay. Ooh, that I could keep delving in and I can't
Yeah.
because we've
Yeah.
like gone over time.
Yeah. No, I get it. I get it. It goes
So
fast.
now, yeah, the drill is that because I do this from my barn at the end of my episode, I always have a saddle up segment where I
Okay.
ask my guests to just give one little tidbit. I mean, you've given us so much, Marrie, but one little thing that someone could do moving forward to better their life right now, something just kind of simple and quick.
Yeah. So again, the tips, if you could balance stress, really important from a hormonal standpoint. Really eliminate processed foods, eat whole foods, and really focus on getting vegetables. I recommend 4 to 5 servings. A serving is a half of a cup, unless it's a leafy green, it's a cup. 4 or 5 servings of vegetables with each meal. Really, really, really helpful for so many things. So, yeah.
Awesome.
Yeah.
Well, now, Marrie, if people want to get a hold of you,
Yeah.
we're going to have all your information in the show notes,
Sure.
but what's the best way if they want to start working with you?
Yeah.
What
Well,
you
I have my website, elevate-hw.com. You can look me up there and get some information. And then typically if people want to know a little bit more about my program or other ways of working with me, then I do a free little discovery call or strategy session, health strategy session, where we talk for a bit and I get to learn a little bit about you and how I could best help you. And you get to learn about me and how I maybe would be able to fit in.
Yeah,
So.
well, and I totally wholeheartedly recommend you. I mean,
Oh, thank
and
you.
so listeners, if you're going through this and need some support, I just find Marrie. She's amazing.
Oh,
So,
thank you. You're
Marrie,
very good.
I may have to have you back on as we
Oh, sure.
delve in
I
deeper.
love sharing. I love sharing stuff.
It's so
So
fun and I love learning from you. So thank you so much for
yeah,
taking the time to be here. I know you're
yeah, for sure.
we so appreciate it.
Yeah. Well, it was great to be here and I really appreciate you inviting me on. So good.
Thanks so much. Take care.
Yeah. Yep. Bye now.